Welcome to another edition of Science North Bluecoat Talks, a conversation between guest experts and a host Bluecoat. My name is Bruce Doran. I am a staff scientist at Science North, and I will be your host today. I'm really excited because we have two guests today, a husband and wife team, both physicians at Health Sciences North. We have Dr. Sarah McIsaac. She's an anesthesiologist and intensivist. And also we have Dr. Robert Ohle. He's an emergency physician. And they have come up with an initiative called Northern City of Heroes, which aims to save lives here in Sudbury, and they hope to expand this across Canada. Now, at any moment, if you wish to join a conversation, please type in your questions in the comments below. Without further ado, welcome Dr. Ohle and Dr. McIsaac.
Thank you, Bruce, so much for having us. We're really excited to be part of Bluecoat's talks today.
Yeah, thank you, Bruce. It's fantastic to be here.
So, what drove you to come up with this initiative? What was stirring in your mind that you decided that we needed this?
That's a great question, Bruce. And it actually started, I think, from Science North. We were invited by the science director, Julie McIsaac, to be a part of Med Talks that happened last year in April. And we were asked to give a 10-minute presentation on something that we were really passionate about. And Robert working in emergency medicine and myself working in anesthesia and critical care medicine, something that we share a commonality is resuscitation medicine. And we wanted to do something that would have an impact on our community. We feel very privileged to have an opportunity to work at Health Sciences North and work in Northern Ontario. And we wanted to be able to give back to our community a little bit. And something that we're both really passionate about is cardiac arrest and how do we improve that survival rate. So if you look at the survival rate for out of hospital cardiac arrest in our community, it's quite low. So I'll throw a question back out to you. If your heart were to stop, and so that's what we call in medicine a cardiac arrest, what do you think your chances of survival would be?
Well, if you base it on some of these medical shows, apparently 100%, but I guess that's not true.
Yeah, everyone survives on a medical show.
Yeah. I don't know, 10, 20%?
So you're close. It's actually less, about 5%. So 95% of people die when their heart stops outside of a hospital, and about 5% survive. And so we know that if you do things like chest compressions or cardiopulmonary resuscitation, which we all more commonly know as CPR, that your chances of survival improve. And so that had Rob and I starting to talk about, well, what if we were able to teach our entire community for free how to do chest compressions? And what if we could increase the rates of bystander CPR? So the amount of people that do chest compressions, would that have a survival impact? And we think the answer is yes.
Cool. So the idea is to teach people how to do chest compressions to increase the rate of survival. But don't we have to take a special course for that? Like, are we allowed just to go around and teach people for free, just like that?
Yeah, it's the simple answer is yes, absolutely. Like, what we want to break down is people's perception that CPR is a medical intervention that only a physician, only a paramedic can do. It is a simple thing which anybody can do. We have a 3-year-old daughter and a 5-year-old son, and we've taught them both how to do chest compressions. Now, to be fair, the 3-year-old chest compressions, they're not the best ever, but it's something which can be learned, and it's simple. And it's something which we're trying to change the perception so that people think of CPR like a life skill. So when you think back to before there was 911, so we want people to think that CPR is as easy as calling 911. It's as easy as knowing how to use a fire extinguisher. It's a life skill that everybody knows.
And you don't take an expensive course. you can learn for free. And we want to help our community do that.
Oh yeah, because obviously that's a limiting factor, because if you have to take this expensive course, you have to take it at a certain time, you're kind of limited on what is. So are you showing all the aspects of CPR, as in breathing and the compressions, or is there an abbreviated version? How does this work?
So a few years ago, the American Heart Association and Heart and Stroke and all the leading organizations for resuscitation medicine took out that mouth-to-mouth breathing component of it. And so we moved straight towards doing hands-only chest compression. And we've looked at, when you look at the literature, it says it's equal in a sense, that doing hands-only chest compression is just as effective as doing mouth-to-mouth resuscitation. And there's lots of reasons why we say that. But what you want to do is you need to continue to generate enough pressure in the heart. When you're doing chest compressions, your hands, so your two hands literally become the patient's heart. And so if you think of the heart as a pump, and the heart's job is to pump in a regular rhythm, continuously, beat to beat, and it pumps blood around and around the body. And that brings vital oxygen to really important organs like our brain and our kidney and our liver. So when the heart's not working or it's stopped, what we need to do is to keep that pumping. And so that becomes really important. And we know with doing continuous chest compressions, so that's just hands-only chest compressions, is just as effective as doing mouth-to-mouth. So for at least many, many years now, we've taken that out. So we just want people to focus on doing hands-only chest compressions. And in doing that, you're going to save lives. You're going to make a massive difference on the quality of life of patients if they survive afterwards. And you're more likely to help save their life.
So that's interesting. So you're taking a component. So we don't even need to think about these 15 1 counts or 32 counts. We're just pumping. We're just pressing on the chest, and we want that blood to move.
Absolutely. Yeah. Just hands-only chest compressions. I wonder, we have a little slide that we can show a bit of the difference with regards to the survival rates.
Yeah, absolutely. I mean, one of the things when people talk about hands-only CPR and whether it should be a medical intervention, one of the important things to know is that if you can wait until an ambulance gets there, you can wait until a paramedic gets there, and our paramedic services within the greater Sudbury area are unbelievable. You have the vast majority of them getting there within 8 minutes, which is incredible. But as time goes by, your chances of survival, if you don't do CPR, it goes down. So if you wait until 8 minutes, your chances of survival, it's almost zero. So this is why it's important that we don't leave this to wait until the paramedics, wait until there's a physician, that people who are there at the time know what to do and know CPR.
Okay.
We know that in Seattle, they have a massive community initiative where they have incorporated into high schools. There is low-cost access to CPR training. There is widespread availability of defibrillators in the community. Their survival rate is 4 to 5 times as high as what we have here in Sudbury.
Oh, yeah.
And so we know that it's possible. We know that you can do this. We know that if you teach people that they will do it and that the survival rate will increase.
That's amazing. So just teaching a whole bunch of people how to do it has really improved the chances of survival. What, almost 20% instead of 5%? Is that what you're telling me, roughly?
So even some centers go up even higher than a 20% survival, and they go closer to 40% survival rate. So it has the potential to truly impact our community. And that's what we're so passionate about, and why we're so excited to work with Science North about bringing this to our community.
Cool. So I'm seeing a sign in the back, and I kind of mentioned the name Northern City of Heroes. That's this initiative that both of you have started. What is that? What are you trying to do as that group, as that initiative?
So it's funny you say, what is Northern City of Heroes? Northern City of Heroes is a community coming together. It is not individual people, This is a massive effort within our community, which already at this stage has had a huge engagement. What it is, it's about inspiring people, giving them the tools and the knowledge and the confidence to be able to perform bystander CPR. And that's what it is at its core. On a more practical terms, what it is a group of amazing individuals at the core, which are driving this initiative forward. One of the things which we were really passionate about was engaging the youth in our community. And we have this amazing student Northern City of Heroes team. And one of the initiatives which has been moving our ultimate goal forward has been the Northern City of Heroes student team giving free CPR education to high schools within the greater Sudbury area. These are the most inspiring high school students that you will ever meet. And they give these incredible world-class presentations for free to high schools and elementary schools around the greater Sudbury area. And because of their engagement, because of their passion, we've been able to train, what was that at the last count, Sarah?
I think well over, close to approaching 2,000 people and how to do hands-only CPR in our community. And it's a really nice collaboration. As Rob said, I have this incredible team of high school students. We also partnered with our paramedics that come, and the HSN simulation lab that also comes and helps out. We also have nurses and physicians from the hospital that are involved in this, and they all donate their time to teach our community members how to do hands-only chest compression and how to use an automatic external defibrillator or an AED, because it's so important to us. We want people to go home. We want people to have great outcomes from having a cardiac arrest. That's a devastating event. And it's really wonderful when patients survive that and get to go home to their family. We often think that cardiac arrests just affect the elderly, but they don't. A cardiac arrest can affect anybody at any age. And so it's really important that we learn and we teach people how to do this. And so through collaboration, because this can't be both of us teaching chest compressions across our community, that's not sustainable. But engaging individuals across our community has made this very sustainable and very effective. And so we're really excited to be part of this team.
So you have, just kind of clarification, you have high school students going into high schools to show them how to do hands-only CPR?
So we have this great team of high school volunteers that not only learned how to do basic life support, they learned how to give a scientific presentation through support from Science North. They practice a presentation, and then they go to high school and elementary schools and teach hundreds of students how to do hands-only chest compression. They have question and answers. They're partnered with a medical professional, whether it's a paramedic, a nurse, or a physician that comes in and is there for some content expertise if needed, but it's all driven by our students to help engage our student community and how to do hands-only chest compression.
Cool. Is there a cost to this? Like, I'm just throwing questions out there.
No cost at all. So it's all done on a volunteer basis. And so it's really exciting for us to be able to offer this, and without the support of the high school students, and they put in an enormous amount of time to do this. And they just come to the school. It's free.
Wow. So obviously there's probably some uptake from local schools if you're telling me you've already got 2,000 students that already tried, considering the fact that, you know, we had to stop, right? And the important part of the school period when it comes to field trips and things like that.
Absolutely. So let's talk about that a little bit. COVID has obviously drastically affected how we teach. We now do virtual learning sessions, which is an exciting thing. That's something new we're learning how to do. But we're also going to be able to teach our Northern City of Heroes program on June 22nd at 10 a.m. through Science North. So we'll have that opportunity to teach that, which I think is great.
Yeah, I mean, like it's the way the world is at the moment. It's allowed a lot of opportunity. You know, you can focus on the silver lining, the positives, the potential for incredible innovation, and that's one of the things that the team is trying to pivot over. Like, so the schools, there is no in-person teaching. That doesn't mean that we can't still teach, that we can't still get the message out there. And so we've been working since the schools have closed down to change how we are presenting things. And we've had engagement from the student team and then the simulation lab and the hospital and Science North to change this presentation so that we can deliver it. And that all that work and all that innovation, the culmination of that is going to be on June 22nd, where the student team is going to deliver the same presentation, but have the ability to reach many, many more people. And I think that's one of the coolest things about what's going on at the moment, is that there's these positive stories through all the worry that we have these days.
Very nice, very nice. So just one thing, just want to remind our audience members, if you have any questions, you want to join the conversation, just write your questions down. We actually have one, and the question is, if somebody is not a student, is not a high school student or elementary student, how can they join one of those learning sessions?
That's a great question. So right now on June 22nd, that I believe is open to everybody. So you can log in on June 22nd through the Science North. That will be open to everybody. We have done presentations across in different centers. So last May, when Science North was open, we did every weekend for the month of May, we were teaching hands-only chest compressions.
That was in 2019, right?
2019, not this past year. You're right. We've already passed a year has gone by. It's amazing how fast time flies. This is the last year. And then moving forward, when Science North opens up again, we're really excited to have our first ever in the world hands-only self-directed CPR exhibit. And that's located on the 4th floor of Science North, just as you come off the elevators. And I am thrilled for when Science North is open and that exhibit will be up and running again.
Yeah, I've been involved with making that exhibit, and we're excited also to have that there and have the opportunity for people to try out in an education, fun, relaxed way, and frankly, just try it out. We just want people to try it out. So that's we're really excited also to.
I think you said something really important there, Bruce, though, too, is to just try it. So we really believe if we can teach you to do the first chest compression, you won't stop. It's always scary. And Rob and I were talking about this on the drive over here, and we were saying, we remember that first time we had to do chest compressions. And at that stage, I had many, many courses in resuscitation. And I still remember that fear. I still remember that feeling of, am I doing this right? Am I going to hurt them? What happens if I do this wrong?
Yeah.
And so I can't imagine what that stress is like if you haven't had a course and you're doing that on somebody that you more than likely know. And
why would you more than likely know?
So that's a good question there.
Yeah.
Well, most cardiac arrests, so cardiac arrest meaning your heart stops, most of the time they happen at home. And I do mean most of the time, so 80%.
Wow.
Vast majority happen at home. And this slide that Rob's just sharing here, this is a really important slide to me from a personal level. So that's my grandfather and that's my son. And my grandfather was an incredible individual who inspired me to go into medicine. He was a World War II vet. He was part of the Canadian forces. He flew airplanes during World War II. And then he came home and he became a local general practitioner. And the classic general practitioner that you think of and you see in movies that would carry a black bag and go to people's houses and probably delivered half the babies in a town. And he was very instrumental in my decision to go into medicine. And he also instilled upon me that feeling that it's very privileged to be a physician in a community and you should give back and you should teach people. And so he was very proud of what I did, but I did a lot of, I got here because of him. And he was always ready to teach. So that's him there teaching my son how to use the electric chair buttons. He's always very patient. And this was just a photo shortly taken before he passed away.
Okay.
And he reminded me that most cardiac arrests occur at home.
Mm.
And when we looked at our own family and we asked ourselves, do all our family members know how to perform chest compressions? The answer was no.
Mm.
And so we wanted to teach our family members how to perform chest compressions. And then we wanted to expand that into our community.
Very good. I have a question here. Have you seen any impacts on survival rates so far? And how are you tracking this at this point?
That's a really good question, and it's a difficult thing to track due to the numbers and how we collect the data. In Sudbury itself, we're actually part of a Canadian program where we collect all data for out of hospital cardiac arrests. So through that machinery there, we're collecting data on the rate of bystander CPR, and then also the survival. When you're interpreting that, you just need to be a little bit careful about other things which may change over the course of that time and whether they have an impact on your bystander CPR and your survival rate. However, that being said, we have seen a noticeable increase in our rates of bystander CPR pre-Northern City of Heroes and after Northern City of Heroes. There's a lot of different people in the community working on this. There's a lot of educational programs put out by Heart and Stroke Foundation. So there's multiple things. And to be honest with you, it doesn't matter a huge amount what is the reasoning behind the increase in the rates of bystander CPR. Ultimately, we are improving and we are getting better. We've gone from 1 in 2 to higher than that who are receiving bystander CPR. And so that's happiness right there.
Very good. Now, you mentioned something, Dr. McIsaac, really interesting, that you said in your family, and that's probably also in my family, that very few people knew or know how to do CPR. Other than costs, okay, obviously there's cost to take the course and things like that. Is there anything else you think that would impede people from learning bystander CPR or anything like that?
So there's lots of studies that look at that exact question of why people don't perform chest compressions. So some things are a lack of education, so not actually having the skill set on how to perform chest compressions, or not having the skill set to use an AED, because remember, that's just as important if there's an AED nearby.
Mm-hmm.
Some of it's a fear of causing harm, and that is often a very large fear, is that, will I break their ribs? Am I going to hurt them? And what we always say is that their heart is stopped. So they're either already dead or very quickly dying. So the only thing you can do is help. You're not going to hurt them. What are some of the other reasons we've seen in the literature?
One of the ones is for the ones that do happen in a public place, there's often a big crowd of people. So you're a part of that crowd and everybody expects somebody else to step forward. And oftentimes nobody does. And so one of the things we try to instill in people is that, you know what, you are the one who has the knowledge. You are the hero within that crowd, and you take that first step forward and do that first chest compression. Yeah, those are the by far the biggest barriers that people talk about.
Again, just a reminder to our audience, if you have any questions, just type them in the comments below. I have a question from an audience member. Okay, so we're taking these courses for free. They're not a paid course. You don't get a certificate, so on and so forth. Can I get sued if I do it and the person didn't survive? Like, can I be sued? Can I get into trouble?
No.
Oh.
There is no, you cannot be sued, you cannot be charged, you cannot be locked up for anything that you do, as long as you're doing it with the intention of helping somebody. There's legislation within Canada which protects you from that. There's the Good Samaritan Act, which means that as long as you're approaching a situation with good intentions to help the person, that you're not liable for what happens.
Oh, that's good to know, because obviously you don't want to be in trouble trying to help somebody else. So you mentioned you have a 3-year-old,
Yes.
and you taught them how to do hands-only CPR. So I'm just going to throw it out. What can a 3-year-old do?
So I'll tell you, they can resuscitate a teddy bear.
Yeah, we have saved many teddies' lives.
Many teddy bears' lives to the soundtrack Baby Shark. So I think we might even have a movie clip or a video clip of that.
Yeah.
So the rate of chest compressions is important. It's 100 to 120 beats per minute. So trying to find a song that inspires our 3-year-old, that was Baby Shark at the time. What she can do, well, it wouldn't be very effective. You need to have a certain mass. So you need to weigh a certain amount to do effective chest compressions on an adult. But what she can do is she can teach an adult how to do chest compressions. And she's very effective at that. She's like, no, you're not doing it right. And so she'll tell you. So how we've taught her is you put one hand out like you're stopping a bus and another hand on top, and you go in the center of someone's chest and you push hard and fast. And we taught her to teach it push hard and fast to Baby Shark. So she can do it very effectively on her teddy bear, and that there's been many teddy bears' lives saved in our home. Rob has unfortunately become the victim every once in a while when they're practicing doing their chest compression.
Just trying to have a nap, just trying to have a nap.
Go wake up, daddy.
I think one of the other things as well is it's normalizing it in kids that this is a normal skill. So what can she do? She can bring this into her daycare, her community, her friends, and the fact that she knows how to do CPR. So she can be a person going forth and saying that this is a normal thing. In a practical terms as well, she knows that if somebody is on the ground and not moving, to say, hey, are you okay? So in practical terms, you could potentially draw attention to somebody who, and then as Sarah mentioned, there's the idea about learning the rate, learning where you put your hands at a young age. And then if people aren't doing it right, even if you yourself are differently abled and not able to perform CPR, you're able to coach whoever is there.
Okay. So on June 22nd, that's what we're going to do. We're going to have a presentation, a live demo on how to do this. We'll have some of your students showcasing that from the Northern City Heroes. And I heard that people from the simulation lab may also join us.
Yes, we're very excited. We have some of our simulation educators from the Laval Innovation and Learning Center, which is our HSN simulation lab, who will be on the line. And they'll have a high fidelity mannequin that will also demonstrate how to do effective chest compressions.
Oh, that's very interesting. So now, I mean, we're going to have that presentation to show us, but you, in the age of COVID, is there any changes in which you would do this? I mean, obviously, if you're dealing with family members, my sense is go ahead and do whatever you need to do. But obviously, when you're dealing with somebody that is not within your media bubble, how's this a little different than what it was?
So that's a great question, Bruce. So we talked about that 80% of out-of-hospital cardiac arrests occur in the home.
Mm-hmm.
And so with social distancing, well, we don't have any data on that right now. I suspect that number will likely increase because people aren't going out to public places anymore. So the newer guidelines and the recommendation for bystander hands-only chest compression include the following. So you're going to call 911 like you always have. And if you have an AED, so an automatic external defibrillator, you're going to call for that right away. And then they've added this one piece to prevent contamination. So place a cloth, towel, or clothing over the person's mouth or nose. And so that's the piece of recommendation that's changed with COVID-19 with regards to hands-only chest compressions to prevent contamination. So grab a towel, grab a t-shirt, whatever you have nearby, place it over the patient's nose and mouth, and then continue to do everything else remains exactly the same. So
because you're not giving any breaths.
Exactly. We're not giving any breaths. So there should be minimal risk to contamination if you're worried about COVID-19.
So I heard that you, especially with the high schools, you show how to use an AED. Question, can somebody get hurt from using an AED, especially if they're not trained properly, right? They don't have the certificate and things like that.
So that's the beauty of AEDs. You literally just follow the steps on an AED. It will not deliver a shock if it's a non-shockable rhythm. So in medicine, there are certain causes that make your heart stop. Some of which, so we call it ventricular fibrillation or ventricular tachycardia, is a medical name. That means your heart is pumping in an irregular beat, so it's not effective anymore. Those are what we call shockable rhythms. So an AED will shock the heart and deliver a shock appropriately. If it doesn't sense that rhythm, it will not deliver a shock. So you cannot hurt somebody with it.
Okay. And you can't get hurt from it either.
You can't get hurt from it either. So it's going to tell you to stand back away from the patient. It's going to say charge, and it's going to say deliver a shock now. And so there's a voice prompt on all the AEDs, and you just follow the steps.
Okay. So you can't hurt the person and you can't hurt yourself.
Correct.
Okay. That's good to know. I have a question from an audience member. They asked, have you heard of any initiative like this, like Northern City of Heroes, going on elsewhere around the world?
There are fantastic initiatives most recently in Scotland and Wales, which are championing the idea of training for all high school age children. So the WHO says that every child over the age of, or young adult over the age of 12 should receive CPR training every year until they graduate high school. And it's been incorporated into curriculums in places like Denmark and Sweden, where they've seen, as part of Driven Initiative, that their survival rates have continued to climb. So in Wales and Scotland, what they've done is they've partnered with a national organization, the British Heart and Stroke Foundation, with local community initiatives in order to bring that training into the schools. And what they've done is, through those initiatives, they have been able to introduce legislation into Parliament there, so that it says that, you know what, this is something that we should do, and that's something which is expected of all schools. So they're slowly changing the culture there by introducing it into all schools, that just like you learn math, English, science, you learn CPR, because that's just as important.
Do you think it's something we should have here in Ontario?
So we do have some programs that offer AED training and chest compression training through the high school. The slight difference with Northern City of Heroes is that we really want it to be a community base. So not just the high school and elementary schools, but also the entire community. So we've engaged some of our senior citizens community centers. We've had other people reach out that run, for example, recreation parks and want to have some training on how to perform hands-only chest compression. So again, just expanding. And I have to say again, our partnership with Science North is just incredible, right? That this is an entire community initiative that expands outside of the school system to literally our entire community and reach as many people as we possibly can.
Yeah, absolutely. And there's a wonderful Canadian organization, the ACT Foundation, which has done a lot of work in training people in hands-only CPR. And so what we're trying to do is all work together to augment each other, to work towards the same goal, which is really getting as many people as possible trained in hands-only CPR and AED use.
So how have people reacted? Like you do your training sessions, people show up. How has been the reaction? Have they been squeamish? They don't want to do it? How has it been with most people?
It's been really inspirational. I think from last May 2019, with our hands-only chest compression sessions at Science North, some things that touched me very deeply were a husband and wife team that came in, and the wife had performed chest compressions on the husband. So he had come in to make sure he knew how to perform chest compressions, and he survived. And then families bringing in their children to learn how to do chest compressions and kind of demystifying it. And the whole family learning how to do chest compressions. It was amazing to watch a whole 4 generations of the same family all learning how to do chest compressions. And people that have previously had certification courses or had done CPR training, we had this high fidelity simulation task trainer. And so it would give you feedback of whether or not you were doing effective chest compression. And it's hard work.
Mm.
I can do chest compressions for 2 minutes and then I need a break. And so it added a little bit of competitiveness to it and made it fun. So we had lots of students trying to beat each other, beat their parents of what their score was. So our simulation set trainer that we had would give you a score of the percentage of effective chest compressions. So ideally, we'd like to see greater than 70% effective chest compression. And so it was really nice to see a little bit of that competitive spirit, because it was teaching us, it was showing us that it was demystifying doing chest compressions. People were learning how to save lives. They were learning how to do it effectively. And it was becoming truly a family project. And that's what we want. We want people to feel confident in their community, in their homes, to know that they're doing really amazing things and doing effective chest compressions.
Yeah, absolutely. And then if somebody learns in school, that they teach their mother, their father, they teach their grandparents, and then you get this massive spread across the community.
And
You
that's
mentioned effective chest compressions. Has anybody come up to you and say, oh, I don't feel comfortable doing effective chest compressions, so therefore I don't want to do this, I might not help? What would you be your messaging to those people?
So first I try to explore a little bit about why they were reluctant to perform chest compressions and find out. We do know from the literature that chest compressions are very physically demanding. And so not everybody can perform effective chest compressions, and that's okay. But if we can teach you how to talk someone or coach someone through it, that's just as important. And so we would kind of walk through about why that is. If it's something that they haven't performed it before, they need some tips on how to do effective chest compressions, then we would walk them through that. But if it's something that they're differently abled and cannot perform chest compressions, then we'll walk them through how to become an excellent coach in performing chest compressions.
Okay.
I think one of the things Sarah said earlier is bears to repeat, is that you can't hurt, that you can only help. And so that's an important point as well.
So even if you cannot do chest compressions or you don't feel comfortable, the fact you're calling, based on that slide, you call 911, that first step, or get somebody to help you, that's better than nothing.
Exactly. That's so important. It's one of the first links, and when we talk about links of chain link of survival, that's the first link, is just activating the system.
Okay, so I mean, I got an 8-year-old, so she's starting to be able to do chest compressions, but a couple of years ago she just couldn't, and I kept telling her, you know what, somebody's down, they're not moving, they're not getting up, or get somebody, start that first step. So at least, even for a 3-year-old who might not be able to do, she can get help and tell people what to do, so that we get the ball going with that. All right, do you want to add anything else before we wrap up?
No, I suppose if people are interested, then I really encourage you to tune in on June 22nd, and then we'll have the full presentation, and we'll really explain about the difference between a heart attack and a cardiac arrest, and go through the actual process where you can actually learn the steps which you can do to save a life.
Oh, so we're going to be able to practice at home based on what you're saying?
Yeah, bring your teddy bears.
So for this presentation, it's going to be June 22nd at 10 a.m. We're going to have this featured at Science North. Here's my question: should the whole family do it?
That would be amazing. Yes.
So the presentation isn't just geared for adults or an older audience. We can have children participate.
That would be wonderful.
Yeah, like we have 2 children, and we've had lots of video calls with the kids running onto it. Like, this is the whole Northern City of Heroes. It's about the community. It's about families, and so it's about us all coming together and learning this. So it would be wonderful to have people with their families on the presentation.
Okay, well, that's fantastic. So thank you very much, Dr. McIsaac and Dr. Ohle, for showcasing this great initiative in helping to save lives here. And I love the fact that it is a community initiative that people can join and learn a very useful, like you said, Dr. Ohle, life skill in order to save a life. And I hope with this initiative, it's going to help demystify, as you said, Dr. McIsaac, that it becomes something normal. That I hope with what you're doing, and hoping also with what's going to be at Science North, that it's going to be as natural as putting a Band-Aid, right? You get hurt, you put a Band-Aid on. This is something that we want people to do. So thank you very much for being part of our Bluecoat Talk. And for audience members, if you're interested in learning about hands-only CPR, there will be a presentation again on June 22nd at 10 a.m. Information will be at our Science North website. It will be open to all, and we will have special presenters showcasing how to do this hands-only CPR. So thank you very much for joining us for this Bluecoat Talk, and we'll see you our next Bluecoat Talk. Goodbye.
Thank you so much.
Thank you.
Stay safe, everyone. Bye.